Hello, I'm going to show you 3 simple points to do some lymphatic priming. I'm not going to call it lymphatic drainage, but the concept is based on lymphatic drainage. I want you to know that lymphatic drainage and lymphatic massage are very different. Don't confuse the two as being the same. When you go to see somebody for lymphatic drainage, they probably have had extensive training in a technique that mobilizes your lymphatic fluid in order to help relieve congestion of lymphatic fluid that can cause very uncomfortable symptoms. Okay, so the first point is going to be here in this area. This is where the drain hole is for the whole entire lymphatic system. Sometimes just opening that drain hole can make you feel better throughout your whole body because you were able to evacuate some congested fluid that was making you feel uncomfortable for some type of reason. Okay, I myself have lymphatic issues because I do have a lot of scar tissue in my neck. I've had multiple whiplash injuries to my neck. I also had a head injury when I was 6 or 7 where I fell on my chin right there. And that little bit of scar tissue has caused an enormous amount of suffering for over 35 years of my life that I actually was able to get over in 2015 and have been symptom-free ever since. Lymphatic work did not cure it. Mechanical work cured it, but doing the lymphatic work along with other myofascial tissue work in my neck has significantly helped me reduce some pressure in my eyes, puffiness around my face, and breakouts on my skin that come from congested lymphatic fluid because of how much scar tissue I have in this part of my body. Okay, so the first point we're going to do is we're going to open up the drain hole for your lymphatic system, your big lymphatic vessel that comes up the front of your body called the lymphatic duct. It pipelines all the way up and then drains in your superior vena cava. Your superior vena cava is the big vein that goes into your heart. And once that fluid is dumped into there, that fluid gets recirculated and reprocessed. Sometimes the way you experience that is by increased urination. Sometimes your body is able to just basically assimilate that fluid, and you notice it by the fact that your body just shrinks down. Puffy areas will shrink. Your whole body size can shrink. The puffiness of your skin can reduce. Any extra lines and wrinkles that you might notice because of swelling can reduce. So that's how we notice that the changes are happening, is that you feel significantly better, your body shrinks down, and maybe you do have increased urination because of that. Okay, so this area here is where I call the drain hole. We're going to open the drain hole first. What you're going to do is you're going to place your hands, your fingertips, I should say, just above your clavicle. So this is my clavicle. You can see that one sticks out, or that bone sticks out a little bit there because of the tightness in my neck. But there is this little notch right here called your sternal notch, which is kind of like a divot right there. We're going to be just above the clavicles with the fingertips, and you're going to place your fingertips on the skin, and you're really not going to do anything but just let the weight of your fingertips be there, which really is not going to be more than 5 grams of pressure. 5 grams of pressure is basically the amount of pressure that you can imagine that a nickel would put on the back of your hand. So a nickel is a coin, and if you put that coin on the back of your hand, that's how much pressure you're going to feel with your fingertips contacting your skin. And you're basically just going to hang out there until you feel movement. And then once you feel movement, you're going to follow that movement without adding any pressure other than the weight of your fingertips. And you're going to just hang out there until your fingers feel like they want to lift off your skin. Okay, so basically, when you place your fingers there, you're going to notice a sticky feeling. You're going to notice that your fingertips feel like they just kind of hook onto your skin. Okay, when you feel that little bit of tackiness or that little bit of magnetism between your fingers and your skin, you're just going to hang out there and stay there. If you don't feel that sensation, it's because your neck is not tight. or your fluids are not congested. So you might not actually feel that sensation. So if you don't feel that sensation, you might actually not have any lymphatic issues to deal with in this part of your body. Okay, so I'm feeling it. It's going really slow. It's moving very, very slowly. I'm not trying to push it. I'm not trying to force it. I'm just keeping my hands there placed, and I'm just letting it go at its own pace. And then when I feel like my fingers want to lift away from my skin, then I'll just lift them up. Okay, and that's now. Okay, so I'm going to do that same movement with just the 5 gram pressure. I'm going to repeat that 3 to 5 times in this area where the drain hole is. And you can see that my fingers are kind of moving back and forth, and that's because the fluid is kind of pulling me back and forth like that. And then I release. Okay, I'm going to do it one more time. And it is the most subtle movement ever. You're not forcing it. You're not pushing it. You're not dragging. You're just kind of hanging out there with that 5 grams of pressure. Our lymphatic system is very sensitive, and we don't need to add more than 5 grams of pressure because 5 grams is all that's needed. So don't think more is better. You want to think less is more. Okay, and my fingers want to come off. Okay, the second spot is going to be up here, because a lot of times when we feel like we're going to get sick, we sometimes feel like we get these lymph nodes swollen in this area, and that can make you feel like a sore throat. Even a derangement, a mechanical derangement, can make you feel like you have a sore throat. So definitely treat your derangement first and foremost. And if you have been a client of mine before and you are a client of mine now, you know that that's what I recommend, is treat your derangement first. And then you can treat this lymphatic situation second. Okay, so the next spot is going to be basically this area right here, just to the side of your neck, and just under your ear and just behind it there. That is called the water wheel. Okay, so in the lymphatic work that I do, where I was trained is the Chickley Institute. We call this area here the water well, and the water wheel. And so your whole skull and your face drain right there. Okay, so when I get too clogged up and my tightness is like this, it's like a tourniquet around my neck, then I get puffy in my eyes and I feel pressure, and then my skin will break out. And sometimes I'll get these weird little kind of like cold sore looking breakouts. It's usually on this side. That's why I'm pointing over there. But they're not pimples. They're these breakouts that happen because the lymph is congested. Okay? I don't have acne, but my skin will break out because of lymphatic congestion. When those tissues get too full and fluid needs to be evacuated, then my skin sometimes breaks out down here. Okay, so this area here, it's called your water wheel. So what we're going to do is we're going to take the fingertips, the fingerprints, you're going to put them on the water wheel. Okay, and so this is what it's going to look like from the side. And you're just going to place the weight, the 5 gram weight of your fingertips, and you're just going to feel that tackiness, that magnetic feel, like your fingertips are being pulled into your skin, and it feels like your fingertips just kind of naturally hook there very lightly. You're going to hold that pressure nice and steady until you start to feel fluid move. And it's going to be very subtle. It's going to maybe take several seconds to to a few minutes. Sometimes it does take a few minutes. And then you're just going to follow that tightness, or you're going to follow that flow of the fluid releasing. And it might not really feel like much at all. It's going to be super subtle, but you're not going to force it. You're not going to pull it. You're not going to drag it. The lymphatic system is very, very sensitive. So you only need to use 5 grams of pressure. And I am tight in here. This is my third time doing this on myself today because I woke up doing this work on myself today. This is the third time I'm doing it right now. And it is taking a while. And sometimes it does. It can take several seconds to sometimes even a few minutes. Okay, and then when I sort of feel that movement, I'm going to follow it. And then when it feels like I've followed that to completion, then I'll just kind of still hang out there and wait until my fingers want to basically lift off my skin. And that's going to be considered one stroke or one pump. Okay, and now my fingers are starting to feel like they want to lift off. Okay, so that was one stroke. I'm not going to do 3 just for the sake of time. Okay, now the third place is going to be hands in the armpits. Hands in the armpits. So you're going to put your hands, your fingertips in your armpits. It's better if you do this on bare skin. Okay, so usually if I'm doing this, I'm either just have no top on or just I'm in a bra and I'm just I'm going to just do some pumps in my axilla area, my armpits. Okay, and so that's all I do is I just hold that position, and it's the same thing as you're not pushing, you're not pulling, you're not tugging on any tissues, just hanging out there until the tissues release on their own, and then you start to feel that fluid move, and then you just follow that fluid movement until your hands feel like they're going to lift off. Okay, and that's one stroke for that. So you're going to repeat that 3 to 5 times. Okay, then I would come right back to the drain hole and I would repeat that one more time, a total of 3 times. So I would repeat all 3 of those movements here, here, here. I would do that circuit 3 times, and you're going to do 3 to 5 times each, 3 to 5 pumps each, but you're going to do 3 times around that circuit. The circuit is here, here, and here. Each place you're going to do 3, 3 to 5, 3 to 5, 3 to 5. Okay, and you can do that whole thing 3 different times a day. You can do it more than that if you need to, but you're going to try to do it at least 3 times a day until either those lymph nodes start to soften or you start to feel that drainage. Today, multiple times, I was able to actually hear the drainage. I was actually hearing all these drainages actually in my tummy area because opening the drain hole actually was having an effect on my whole body. So hope that helps. All right. Take care. I'll see you soon. Bye.